Let's talk
Okay.
about COVID-19 side effects. What's normal, what's not. Let's talk about normal side effects people can experience.
These vaccines are very safe. And so the side effects are what we expect to see in an individual who is vaccinated with a vaccine that's going to produce a strong immune response. And that's basically what we're seeing in the vast majority of people who get the vaccines. So the most common side effects are going to be local. They're going to be in the arm where the vaccine was given. So there might be some pain, discomfort, some swelling, and some redness. And that usually will last 3 to 5 days. It's generally fairly mild, and it often does not interfere with your normal daily activities. The second type of reactions that we see are really what we call systemic reactions. So within the first 2 days after you get the vaccine, you may experience fever, chills, muscle aches, fatigue, so sort of what we call flu-like symptoms. So, and again, that's a sign that your body is recognizing the vaccine and developing an immune response to the component of the vaccine that's really important, the spike protein component. After the second dose of vaccine, those symptoms could be more significant. So after the first dose, you may have minimal systemic symptoms. After the second dose, they may be more exaggerated. In every case, however, those symptoms tend to resolve within 48 hours. So we generally say you don't need to take any medication before you get vaccinated. But if you start having significant side effects after you're vaccinated, then something like a dose of Tylenol might be appropriate if you have significant symptoms. You don't have to treat everything. And so I would only treat if the symptoms are enough to make you uncomfortable. You might have enough reaction, especially after the second dose, that you may not want to work the day after the second dose. That certainly has been described in a number of people. But overall, the vaccines have been very well tolerated. These symptoms are going to go away within 48 hours. And if you compare them to what happens when you get COVID, it's a small price to pay to become immune against the COVID virus.
Do we know why the second dose of the vaccine can potentially cause more intense side effects?
Well, I think it's because with the first dose, a very significant portion of people have a very strong immune response to the first dose. And because of that, you already have some antibody, you already have some cells in your body that recognize the protein, so they're already geared up to respond. So it's very likely that that preparedness from the first dose gets you a better response from the second dose. Now, if you are a patient that gets the vaccine and you get no symptoms, doesn't mean that your immune system's not responding. It means that your system is responding, but without causing all these other minor symptoms.
Speaking with David Langston, Caddo Parish's first COVID-19 patient, he said, speaking with Dr. White, that people who have gotten and recovered from COVID-19 can sometimes experience more intense symptoms when they receive their vaccine as opposed to people who have not gotten COVID-19 and get their vaccine.
Yeah, that's been described. And I don't think we know enough to know how often that happens, how frequent it is. And there's some people who have said because of that kind of response that since you already have antibody and protection from the infection, and again, we don't know how long that would last, but then you boost it with the vaccine, that may be why you might see more of an effect after the first dose than we see with people who never experienced the virus. It's not a reason to not get the vaccine. The vaccine is much better in producing an immune response, and it's really expected that the vaccine will produce even longer protection than the natural infection. So even if you get that response after the first dose and you have had COVID in the past, you still need your second dose and you should get it. And it may be that the second dose is not even going to produce as an intense response as the first dose was.
With COVID-19 symptoms, we described those that can be described as normal. What are some symptoms that someone might develop after receiving their vaccine that may not be considered normal, that they should potentially reach out for medical assistance?
Well, I think the one side effect that we've recognized is very rare, but obviously very important, is a severe allergic reaction. So if you get hives, swelling of the face, especially the lips or the tongue, that's an emergency, and that needs to be taken care of by going directly to the emergency room or contacting EMS. That's very rare, and it's very likely to occur within the first few hours after you've received the vaccine. So, but that would be one of the only things that is generally going to happen after the vaccine that you need to do something about urgently. If a patient has gotten the vaccine and they start having symptoms that they're uncomfortable with, that they're worried about, well, obviously they should call their doctor and have the doctor evaluate the symptoms and then make a decision. You know, there are some patients that we have had when COVID was really spreading very rapidly where they got their first dose of vaccine, but they got COVID or some other problem within days of getting the vaccine. So it wasn't the vaccine that was causing symptoms. It was COVID or some other agent or some other process. And so I think people just need to think, if it's not one of the things that we've talked about, or it's more severe than one of the things we've talked about, then they should contact their physician, or if it's more urgent, you know, go to an urgent care center or an emergency room, use their judgment about that. And so if they're worried about symptoms or there are things beyond what we've talked about, they should really consider talking to their physician or making a visit.
And after someone receives their COVID-19 vaccine, they are monitored for about 15 minutes, correct?
That's correct. And actually, if they have a history of some underlying allergic reaction that they've had in the past, we would even keep them being monitored for 30 minutes just to be safe. But yes, everybody's monitored for at least 15 minutes.
There's still a lot being researched about the COVID-19 vaccine and the side effects. The CDC says they're still looking for input, as well as other health officials. Although there still are some unknowns with this vaccine, it is safe to take.
It's very safe to take. And now we've got, I don't remember the exact number, but it's multiple millions of people in the United States who have now been vaccinated. I think, is it around 40 million people? Almost 10 or 12% of the US population has been vaccinated. And the only issue that we have really identified that's different from the clinical trials is the rare risk of a severe allergic reaction. And it generally occurs in people who have had severe allergic reactions in the past, and that's why we monitor those individuals more carefully. But when you look at all those people and look at the safety systems in the United States, there's a vaccine adverse event reporting system that has existed in this country for many years, and that's being utilized. And then the CDC has a new program called V-Safe, which when you get your vaccine, you can actually link your telephone, your smartphone to the CDC, and they will, on a regular basis, contact you and ask you about side effects. So based on those two reporting systems, the CDC has not really identified any significant safety issue with the vaccine. And now we're up to, like I said, over 40 million doses being given. And so I think we have strong evidence that all of the three vaccines that have emergency use authorization in the United States are proving to be incredibly safe.